Hello, my name's Fiona Hill. I'm one of the ear, nose and throat surgeons here at Melbourne ENT Group, and today I was going to describe a common condition that we see with patients, which is acute otitis media, or a middle ear infection. I was going to go through the reasons why acute otitis media happens, how patients present, the different treatments that are available, and some of the things to look out for. Acute otitis media is a common problem that we see mostly in children. Around 50% of children by the time of their first birthday will have had a middle ear infection at some stage. The good thing about most middle ear infections is that they will resolve on their own quite rapidly, and many of them don't actually require treatment. The symptoms that patients present with acute otitis media partly depend if they're an adult or a child. For an adult, it can be quite obvious if you've got a middle ear infection. Normally you'll get pain, hearing loss. You may or may not get ear discharge, and you can also get fevers and just a feeling of general irritability. However, for very small children, it can be much more difficult to diagnose. Most children will present with fevers, ear banging, putting their fingers in their ears. They can get diarrhea or vomiting. They can be off their food. You can also notice that they develop speech or learning problems or aren't learning to pronounce sounds like they should be. Possible complications in acute otitis media to look out for include hearing problems, burst eardrums, or recurrent ear infections needing further intervention. A burst eardrum or a tympanic membrane perforation is reasonably common with a middle ear infection, and it's normally when the pressure inside the ear gets so great that it actually creates a rupture in the eardrum. That in itself is not normally particularly painful. In fact, it often allows the pressure and the fluid to go away, and a patient can feel better quite quickly afterwards. Normally, the eardrum will repair itself. In only a small percentage of patients, the eardrum won't repair itself, and we would normally recommend seeing an ENT surgeon after a number of months. Hearing problems can occur in children that are getting a number of ear infections. This is often because once the infection is resolved, fluid can remain trapped inside the middle ear. We call this a glue ear, and there is an information sheet and video available on our channel about this as well. Glue ear, if it's been present for more than 3 months, or if a child is developing learning or speech difficulties, can be treated with a grommet, which I'll discuss in another video on our web channel. Recurrent ear infections, which we call a child having more than 3 ear infections within a 6-month period, can also cause quite significant disturbances in a child and quite a lot of time off school. If a child's getting recurrent ear infections, so more than 3 every 6 months, again, your GP should consider referring through to an ENT specialist to discuss treatments such as grommets or even an adenoidectomy. When treating a middle ear infection, there are a number of treatments available. For most people, we would normally just recommend what we call conservative treatment, which is just giving painkillers and symptom management. For many children, the infection will go away even without antibiotics, and if you can avoid using unnecessary antibiotics, that's always preferable. If a child is older than 2, if their infection isn't severe, if they don't have other concerning medical problems, like an immune compromise or a cochlear implant, we would normally recommend holding off antibiotics for 48 to 72 hours. But obviously this should be done at the guidance of your local doctor. In patients who are very young or have very severe symptoms or other medical problems, or if their infection's going on for more than 3 days, then normally syrup or tablet antibiotics are the next option. And these will normally be given for 5 to 7 days. If the eardrum has burst and there is fluid coming out, eardrops will often be prescribed as well. Surgery is rarely required in patients with recurrent ear infections. Normally only if they're getting very persistent ear infections do they need to consider adenoidectomy or grommets, or in very rare occasions where children may develop certain abscesses behind the ear, which we call mastoiditis, or in the bones around the ear, then you may need to be going to an emergency department for further review and maybe an emergency operation. But the good news is that this is extremely rare in acute otitis media. Most children with an acute otitis media won't need any follow-up with their GP or with a specialist. However, if their symptoms are persisting, if they are getting particular problems such as swelling behind the ear, then they may want to seek emergency treatment through the emergency department. If they are getting persistent ear infections, or if they're having speech and learning problems or hearing problems, then they may want to see their GP for a referral for an audiogram or for a referral to an ENT specialist to further describe other treatment options available. Thank you for listening to this video. We do have more detailed information sheets on our website, as well as videos and information sheets about glue ear, adenoidectomy and grommets. Please don't hesitate to contact us at the Melbourne ENT Group if you would like an assessment with an audiologist or with an ENT surgeon. Thank you very much.